Good evening, everyone. I'm Mike Freda, North Haven's first Selectman, and thank you for joining me this evening. I wanted to, in an ongoing effort, to continue to give you updates as to where we are as a town on this, as I referred to last time, this invisible enemy. So tonight's update to our residents is in two parts. In the first part, I'd like to share with you where we are as a town in terms of services and from an operational standpoint. And then, after that, I'll take you through as to what the latest is here in North Haven and overall on this coronavirus. Let's take a look at the town services, and I wanted to provide a recap as to where we are as we sit here today, March 30th. What we have implemented, as I shared with you last time, is all the schools, the library, the senior center, the pool, the community services, our daycare center are all closed until further notice. Although our town hall and annex buildings are also closed, our employees are still working. We are continuing to encourage the use of online services. All of our online fees have been waived. We are, to a certain extent, still working for any critical services or interfaces that need to be demonstrated to our residents or some of our businesses, and these appointments will be required on an appointment-by-appointment basis. Our town programs and events, all of which have been suspended indefinitely. As I mentioned last time, we have implemented an electrostatic sprayer system with enhanced superior disinfectants and sanitizers and antivirus components. What we're doing is we've actually stepped this up, ladies and gentlemen. In addition to sanitizing and cleaning the buildings every night, we are now increasing the level of the high-powered electrostatic sprayer system and continuing to disinfect police cars, public works trucks, fire department equipment, and this will continue here as our employees continue to work very hard here and also work to continue our core services that we offer here in town. Now, those core services continue to be fully operational. Our fire department, our police department, our recycling and transfer station, and our sanitation department. I'd like to spend a minute with you regarding sanitation. We're starting to see a trend, and that trend is that the more people are staying home, which we certainly advise, the more municipal waste is being accrued and being asked to be picked up by our sanitation and our public works crew. This is very important because what's happening, ladies and gentlemen, is that we have now a situation where a lot of residents are not using plastic bags. They're putting loose trash into the green trash containers. And what we're seeing now is more masks, we're seeing more gloves, and it's kind of exposing our public works staff to that. I need your help on this, ladies and gentlemen. Please, please, in your municipal waste collections, please put the waste in the plastic bags. Put the plastic bags inside the green containers. This is being done for the safety of not only our residents, but also our employees. The last thing we want to see here in town is if the coronavirus infects any of our staff or employees and our public works people cannot pick up the trash, we will see a significant backup in that service to our residents. So I'm asking everyone to please put the loose trash in the plastic bags and put the plastic bags into the green container. That would be very, very helpful. And there's a slide kind of illustrating that. It's very important for the safety of you as our residents and also our public works employees. As you know, we postponed bulk pickup. We will be offering that service, and the dates will be, as we mentioned last time, June 15th and June 16th. Place the items at the curb at 5 a.m. on your designated trash collection day. And if there's any questions at all regarding that service, please feel free to contact Field Operations for any terms, acceptable terms, or further information that you may need or require. Our community services, we've been assembling bags of food for our residents at a very rapid rate. Since I was last here presenting to you where we are as a town, our food bank has run dangerously low. We are very grateful for donations that are starting to come in. Food bags are being prepared by the staff, and each resident is given an appointment to pick up whatever they need, whatever they've requested, on the front steps of our annex. And our very critical counseling services for those in need, for those experiencing problems in their personal lives. These counseling services are continued to be offered here through our association with BH Care and our community service counselors, and those services are continuing to be done via telephone and teleconference. All of our board and commission meetings have been canceled and they've been postponed for the entire month of April. In May, we're looking at making arrangements. We will be determining as to where we are and how this pandemic continues to grow. We're looking at potentially in May to do a teleconference or closed meetings with board members only, where the public would have the ability to view or listen to each meeting and view the meetings on NHTV, but the meetings would be done with the board and commission members via a teleconference. And this is something we're looking at, and May could potentially be the start date of that. As we approach May, and as we approach what would normally be our town annual budget, it's critical that within the next 10 to 12 days, or 10 days to 2 weeks at the onset, I'll let you know how we'll handle this year's budget. That'll be part of my next update to each and every one of you. Now let's take a look at where we are, ladies and gentlemen, as we sit today regarding this COVID-19 update. As of March 29th, the statewide total of positive cases was at 1,993. But because we prepared these slides the other day in anticipation of this live broadcast, I just learned at 4:30 this afternoon that in Connecticut, that 1,993 now is 2,571 as of today, March 30th. Out of the 2,571 or 91, right in that range, over 20% of those cases have required hospitalization, putting a tremendous strain on our healthcare system. As of March 29th, there were 404 people hospitalized. Now there's over 540 people hospitalized. And unfortunately, there have been a few more fatalities. As of today, March 30th, there are now 2 confirmed cases of the coronavirus here in town. That's 2 that have been documented, but also there are 2 others who've reached out to me personally and have told me that they have the coronavirus, but they haven't been tested. When I asked them how they knew they had it, they had all of the symptoms, and through a teleconference with their doctors, one of them said to me that they've been quarantined and in bed for 11 days. So even though officially we have 2 confirmed cases, it looks like right now there are 4 here in North Haven. Now, last Friday, I declared a state of emergency here in town. All along, the focus point of that was that if I found out there was one infection here in town, that would trigger the declaration of emergency. Now we have 2 and probably 4. So I wanted to just explain the declaration of emergency. The declaration of emergency in any municipality grants the CEO the authority necessary to minimize the effects of the emergency. And what we were seeing was that there was a lack of compliance on social distancing. We saw our parks crowded, basketball courts being used extensively with a high number of people playing basketball. And the declaration of emergency allowed me to do something that I thought was very necessary. And that is to order all the parks, the playscapes, the fields, the turf fields, the tennis courts, the basketball courts, and everything associated with that closed temporarily until we can get through this critical time. I decided to leave both the North Haven track and the town green open. I recognize, ladies and gentlemen, that everyone needs some sort of recreation. They need to recreate, particularly during these difficult times. So we thought that by leaving the track open and also leaving the green open, there was enough space where people can walk and recreate, but still maintain the very important social and physical distancing. So we are watching it closely. Our police are taking notice, but please understand, it's a step that needed to be done. We're trying to protect the safety of our citizens. And right now, as of today, we saw very good compliance. I was very encouraged that on our green and on our town track, the social distancing was being practiced. So the last time that we were here together, I talked about and described this dilemma that we have, this pandemic crisis, as the invisible enemy. And I've drawn another conclusion. It's an invisible enemy that now has taken on multiple proportions all over our cities or towns. It's invisible and we don't know where it is. So when we consider how we should view and approach and battle this invisible enemy, let's take a look at some of the recent data that I was informed about. This virus gains entry through eyes, nose, and mouth, and particularly spreads in rapid proportions when people have hands that have not been washed or sanitized and then touch their face. This has been well established right now, and everybody has been talking about that. Once the entry is gained, this virus attaches itself to cells in the human body by latching what's now been referred to as medical experts as its spiky surface protein. The spiky surface is a protein, and the protein then goes to the receptors in normal cells and eventually kills healthy cells, thereby causing severe illness. Now, the body's immune system immediately will tend to try to counterattack that. And the first two mechanisms that the human body will do as a counterattack, as its own immune system tries to battle this virus, are a fever and a cough. What we now understand is that this virus is not really a living organism, but it's a protein molecule, and it has its own vulnerabilities. And this is one of the things I'd like to speak about tonight. One of its intrinsic vulnerabilities and fragilities is the fact that it is fragile in many respects, and it can only decay on its own. This is why all of us have been talking about social distancing. The more confined the space, the more the concentration of the virus will be there. Now, the more open the space, where there is open air, the less the virus can concentrate, provided once again that people are not in close proximity with each other in groups. This continues to be a very important point. There are ways for us to defeat this invisible enemy. The paradoxical situation here involves it's a powerful invisible enemy, but yet it has its own vulnerabilities. And here are some things, some of which you already know, on how we can help defeat what we're going through. This has been spoken about many times. A rigorous washing of hands. in warm to hot water. Generally, ladies and gentlemen, 77 degrees is the temperature. I know that's difficult to calculate when we're washing our hands, but warm to hot water with a minimum of 20 seconds. This will disintegrate the protein-based virus. When we wash clothes and do laundry, hot water versus cold water. The washing of hands after touching doorknobs, locks, light switches, cell phones, remote controls, computers, desks, and of course after using the bathroom. Consider using alcohol-based wipes to wipe down cell phones, doorknobs, if you don't have the hand sanitizer. Rite Aid, as an example, at their front desk is offering 1 box, a limit, on alcohol sanitizers. Those can be very effective. They're at least a 70% alcohol content, which should be effective on some of these surfaces, these hard surfaces. And hand sanitizers are very effective also. There's a way to make your own hand sanitizer. If you go on a website or Google it, how to make hand sanitizers, believe it or not, lemon juice, aloe vera, and also isopropyl alcohol, which I realize is in short supply now. But with a proper blend, you can go online and you can see how you can make your own hand sanitizer. Let's look at some of the updated symptoms. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease, COVID-19. These symptoms, as many of you have already been told, may appear 2 to 14 days after exposure. The symptoms include the fever and the cough, which once again is the body's immune system as a counterattack against the virus. The shortness of breath is also a very demonstrable symptom. Fatigue, chills, and now we're hearing the loss of taste and smell. Those are the symptoms associated with this. So the question becomes, when should those who have those symptoms seek medical attention? Well, if you develop emergency warning signs, our recommendation, and those of the medical experts, is to get medical attention immediately. And again, those signs include trouble breathing, which can result in a persistent pain or pressure in one's chest, some confusion or inability, bluish lips or a face that becomes blue. And although this list is not all-inclusive, please consider consulting your medical provider for any other symptoms that are of concern to you. This slide here, there's a Yale New Haven Health hotline that we mentioned during our last meeting, a Hartford Health hotline. And of course, this company on 163 Universal Drive is willing to accept phone calls for testing at 163 Universal Drive. Doc's Medical Group is the name of the company. So, to summarize how we can help protect ourselves. We know how it spreads, and we know there's currently no vaccine to prevent this coronavirus right now. The leading health experts anticipate that a vaccine trial will start sometime, maybe later this spring or in the summertime, but it looks like it won't be until early next year that a formal vaccine can be established to battle this invisible enemy. So the best way to avoid the illness is not to be exposed to the virus. And it's been said time and time again, the virus is thought to spread mainly from person to person, between people who are in close contact with one another, within about 6 feet. This is why we're seeing the 6-foot markers if you go into a supermarket or a pharmacy. And through these respiratory droplets that are produced when an infected person coughs or sneezes, this is where the problem starts. Because those droplets can land in the mouths or noses of people who are nearby and possibly be inhaled. This is why, again, we stress the social and physical distancing. Now, we can also take steps to protect our own individual households. Clean and disinfect, some of the things I mentioned earlier, by cleaning and disinfecting the frequently touched surfaces in our own homes, those services, I should say. The surfaces in our own homes include tables, doorknobs, light switches, countertops, door handles, any handle, refrigerator handles, desks, phones, keyboards, toilets, faucets, and sinks. If the surfaces are dirty, it's been suggested everybody clean them and use detergent or soap and water prior to the disinfection. And to disinfect, the most common EPA-registered household disinfectants would work, and use disinfectants that are appropriate for the surface. So it's important that we even be more diligent in this respect, cleaning those surfaces in our homes. One of the things, ladies and gentlemen, that I've begun to notice is that in talking to people either on the phone or handling emails from people, that the virus now has started to cause some anxiety and some depression in our community and other communities. And this is of great concern to me because I care about the residents here in North Haven. I mentioned it last time, I'd like to state it again. I love each and every one of the residents here in town. So I'm very concerned when I see this. So I wanted to offer some strategies to help those that may be experiencing some uncertainty. And some of those strategies may be as follows. Stay in touch with your friends. Stay in touch with your friends through text messages, emails, phone calls, and video apps. That type of connection, even though it's not a physical connection, even though it's not an in-person connection, that type of connection can be very important to help boost our moods, to help us. Spend quality time together as a family, which I know many of you are already doing. Try to do something that creates a sense of purpose. And that could be something as simple as decluttering a house or organizing your personal finances and the paperwork associated with that. For those that feel disenfranchised from their religious communities and some of the churches or synagogues or the places where they worship, there are digital online religious services. I am actually working with the Catholic Church here in North Haven, along with NHTV, and we're working to have masses shown on NHTV. Of course, no one will be in the churches, both on Palm Sunday, Holy Thursday, Easter Sunday. More to follow on that in terms of how we're trying to orchestrate that with our Catholic Church. Sometimes just helping others by donating. Something as simple as donating food to the food bank. That can make a very important impression and can help someone who is in need of food, who may not have the financial resources. That could be very important to help people create that hope. And find something to be grateful for. Think back perhaps on a fond memory you have when you were younger or when your children were born. You might want to consider looking at an old photograph album, you know, when we were all younger, and seeing some of the happy memories that we may have experienced in years past. So these are some strategies that may help for those that feel disenfranchised, for those that maybe have some anxiety. If you feel you need to talk to someone, I'm sure you have so many people that'd be willing to speak with you on the phone, family members and friends. And of course, I here at Town Hall would always be willing to speak with anybody who would like to speak with me. And one of the things I'm very grateful for, ladies and gentlemen, is each and every one of you. We've had a wonderful relationship for these past 10.5 years now, as we're here now in our 11th year. And one of the things that I feel disenfranchised about is that I can't be out there in the community. All the events have been canceled. And that was one part of this job that I truly have enjoyed down through the years. Being with each and every one of you at night, whether it's a concert on the green, whether it's an event, whether it's a dinner. And down through the years, I've always appreciated the well wishes, the handshakes, and even the occasional hugs that some of the residents would give me. So tonight, I'd like to say that I miss each and every one of you. We are here for you in town. On behalf of our second selectman, Mr. Bill Piper, and our third select woman, Ms. Sally Buemi, they also extend their well wishes. But tonight, I'd like to close by offering you all my own personal hug and warm embrace. Since I can't be there with you, rest assured that your government is here for you. Rest assured that we will do everything we can to continue to support you. We care about you, we love you, and we will continue to be here for you. Thank you for your time this evening, and I look forward to our next update. I'm going to plan on doing these updates at least once a week to provide our citizens information as to where we are as a town. Thank you, ladies and gentlemen, and have a wonderful evening.